Hi there everybody, it's Dr. Steve with Kineci, and we are doing your Understanding Your Pain, talking about patellofemoral knee pain. So patellofemoral just means the kneecap on the femur. That stuff is hurting. In the first video we talked about a couple of the old school techniques they used to do to work on that stuff. We talked about some of the mechanics that contribute. So as we're in this part 3, we're going to be working on the activation and strengthening of a lot of the backside of the body, the hamstrings, the glutes, but it's going to be making all these parts work in a bunch of different ways. And what we're going to do is we're going to take reaching and we're going to go in all 6 directions. Now, 6 directions means we have 3 planes of motion. We have a forward and a back. We have the side-to-side frontal plane where we can go to the left, we can go to the right, and then we have the transverse plane for the rotation where we can rotate left and rotate right. So we're going to do all of those combinations and be able to hit all these parts from a lot of different angles. So what we're going to do, I'm going to use the cones now. I'm making it just a little harder on myself by reaching as low as these cones, but targets are very helpful because the body is such a master at cheating its way out to try and pick the easy path. Targets make you have to reach to the same spot every time, and so that keeps the body a little more honest. These cones are just happen to be low ones, so we're going to have to bend a little harder or a little further, and it makes it a little more challenging of an exercise, but we're going to give it a go. So here we're going to stand with the 1 foot forward, the 1 foot back, and as you would imagine, we're going to repeat this with the other foot forward eventually. But what we're going to start with is the forward and back. And so I'm giving you the side view so you can see. We're going to reach out to touch the cone in front, come back up to standing, and then we're going to bend and reach to touch these cones. There they are behind. So we're doing a forward or anterior reach, and then we're doing a posterior reach. And got to kind of dial in where the targets are. The important thing is I want to have you standing all the way tall in between each reach, because that kind of completes the movement versus just trying to be here reaching forward and back. We're not getting quite as much out of it as if you're going all the way down, all the way up, all the way down, all the way up. So that's the forward and back direction, or in the sagittal plane. So now what we're going to do is we're going to do the side to side in the frontal plane. So here, let me line these up a little better. So here we're going to stick with this pattern that I started with, having the right foot forward, and we're going to do an opposite side lateral reach, which is, the term opposite is referencing this front leg. My right leg is in front, so we're going to do a reach to the left, and then we're going to do a same side lateral reach, which is a reach to the right with the right leg in front. So reaching to the left, standing tall, reaching to the right, standing tall. So going back and forth, we're reaching in the frontal plane side to side. This is opposite side lateral and same side lateral. Now we're going to go in the transverse plane. I'm going to move the cones back. So now what's going to happen is going to need to reach around the corners. And so it's going to be the same kind of terminology. When we reach to the left with my right foot forward, it's going to be an opposite side rotation reach. When we reach to the right with my right foot forward, it's going to be a same side rotation reach. So standing tall in between each one. Here we're really rotating to get around the corner to the cone, and then, I put it too far for myself, and then reaching around the corner of the front leg. Now, I just ran into where I was struggling to get my hands there, and that's normal, that's natural, that's what we expect, because with the right foot forward, the pelvis is rotated forward on that side. I'm asking my hands to reach around the corner, which is taking my shoulders opposite the pelvis, which is why that direction is a little harder. So, reaching to the opposite side rotation, a little easier. Reaching to the same side rotation, a little bit harder. One more. Okay. So now what we would do is rinse and repeat with the left foot forward. And instead of running through all of that, you get the idea. So we're going to leave it at those reaches for all 6 directions. That is really activating, lengthening through, and turning on the hamstrings and all of the backside muscles as we go in all of those different directions. And as you do that, you're having to bend a lot, having to come back up a lot. That's what the knee is meant for. That's what it's designed to be, our spring, our shock absorber, our up and down kind of piston as we're bending so much and straightening so much. So that's where these reaches are really going to stretch and strengthen everything. So if you or anybody that you care about in your world are struggling with some knee pain, don't let them sit home and suffer, but send them into Kineci and let's figure out what's going on and come up with an individualized plan for them so that we can get them feeling better and functioning better, to find the relief from pain and the freedom in your body to do whatever it is you love to do. So until next time, keep moving, everybody.